Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
Welcome back, everyone, to the deep dive. You guys have really outdone yourselves this time with the sources.
Yeah, some really interesting stuff.
Really fascinating stuff, particularly all this stuff around hallucinations. I mean, the sheer variety of things that people experience is really remarkable. So let's dive in. When we talk about hallucinations, what exactly are we talking about here?
Well, I think the simplest way to put it is it's a false sensory experience.
Okay.
So that's, your brain creating a perception, something you see, something you hear, something you smell, taste, or even feel without any external trigger for it.
So it's coming from
inside. The brain is just generating that experience all on its own.
Wow.
And what's fascinating, what your sources really highlight, is just how many different things can cause it. You got everything from mental health conditions like schizophrenia and bipolar disorder to problems with the brain itself, neurological issues, the influence of drugs, even just lack of sleep, other health problems that can really come from a lot of different places.
Right. So it's not just like, the stereotypical cartoon image of somebody seeing pink elephants. It can be a lot more nuanced than that.
Absolutely. Yeah. Much more nuanced. And as you said, it can come from a whole variety of places.
Yeah.
And that's what makes it so fascinating to look at.
So I guess our mission here is to try to really unpack that, to get a better understanding of what these experiences actually are, the different forms they can take. You mentioned all the senses, which is pretty wild, and how they affect people's lives.
Exactly. A deep dive into hallucinations.
Yeah.
A hallucination is a sensory experience that's internally generated by the brain without an external cause.
Okay.
And what's really interesting here, what your sources did a good job of highlighting, is how this is different from some other ways that our perception can kind of go off the rails a little bit. So, for example, an illusion. An illusion is different from a hallucination in that it's actually a misinterpretation of something that is really there.
Okay.
So, the classic example is you're in a dimly lit room and you mistake a coat hanging on a door for a person.
Right.
Your brain is trying to make sense of visual information that's not very clear.
Got it. So the code is real.
The code is real.
But my interpretation of it is off.
Exactly. Now, delusions,
Okay.
these are different altogether.
Okay.
So a delusion is a firmly held belief that has no basis in reality, even when presented with evidence to the contrary.
Okay.
And the example that your source gave is, someone believing that the government is following them despite absolutely no proof to support that belief. So that's a classic delusion. It's about the content of their thoughts, not a sensory misfire like a hallucination.
Got it. So just to make sure I've got this straight, hallucination. False sensory input, illusion, misinterpreting real sensory input, and delusion. A false belief that persists even when there's evidence to the contrary.
Exactly. You got it.
Okay, that's helpful. And, just reading through some of these sources, they do mention, if you or someone you know is experiencing hallucinations, especially if they're happening frequently or causing distress, it's important to reach out to a healthcare professional. Seems like an important point to underscore.
Couldn't agree more. Recurring or really distressing hallucinations are definitely something you want to talk to a doctor about to figure out what might be causing them.
Yeah, absolutely. Now, getting into some of the really interesting stuff here, let's talk about the different types of hallucinations. So, as we've touched on, these things can affect any of the five senses.
It really is the full spectrum. It's remarkable.
Yeah, it really is the full spectrum of how we experience the world. So let's start with visual hallucinations because, I think for a lot of people, that's what comes to mind first. What kinds of things are we talking about seeing here?
So visual hallucinations involve seeing things that just aren't there. It can be figures, people, animals. It can be flashes of light, bursts of color, shadows moving in unusual ways.
Okay.
But what's really interesting is your source also mentions, distorted surroundings.
What does that mean?
So it's where objects might seem to warp or bend or change their shape in some way, even though they haven't actually moved. It's not always about seeing something totally new. It can be this really bizarre alteration of what's already in your environment.
Right, like the world around you is kind of shifting and morphing, even though it's not actually happening.
Exactly.
Yeah, that sounds pretty unsettling.
It is. It's one of the more, I think, commonly reported and often quite frightening types of hallucinations.
Yeah. Okay, what about sounds? So auditory hallucinations, I think that's another one that people are fairly familiar with.
Yeah, auditory hallucinations are really common, and they can be very powerful. It's basically hearing sounds that have no external source.
Mm.
Again, it can range from voices talking to you, voices talking about you, maybe whispering, maybe shouting, all the way to just weird nonverbal sounds like murmurs, ringing, buzzing, maybe even phantom music.
Phantom music?
Yeah, isn't that fascinating? The brain can generate music internally.
That is wild.
Your source also mentions repetitive noises, things like footsteps, banging, clicking, that seem to come from nowhere.
So like really specific sounds. It's not just like a general kind of whooshing or something.
It can be. It can be very specific.
Yeah, that's really interesting. Okay, let's move on to smell olfactory hallucinations. I feel like this is one that maybe we don't talk about as much.
We don't. And your sources actually use a great term for it, phantasmia.
Okay, phantasmia.
It comes from the Greek words for phantom and smell.
Makes sense.
Yeah, it's basically perceiving odors that aren't actually there. And these can be, they can be unpleasant smells, rotting food, burning rubber, chemicals, smoke. But they can also be pleasant smells like flowers, fresh air, perfume.
So your sense of smell is basically making stuff up.
That's a great way to put it, yeah.
Okay, that's pretty trippy.
It is. And I imagine it could be quite disturbing, especially if it was a persistent bad smell.
Yeah, absolutely. All right, what about taste? Gustatory hallucinations.
Yeah, so gustatory hallucinations, this is all about experiencing tastes without actually eating or drinking anything.
Okay.
And the source mentions that these are often described as metallic or bitter tastes.
Ooh.
Yeah, not pleasant.
Not pleasant at all.
And or it could be just a really unusual flavor that lingers in your mouth and doesn't make sense based on what you've actually consumed.
I imagine that could really mess with your appetite.
Yeah, I would think so, yeah.
Okay, and then finally we've got tactile hallucinations, which is the sense of touch.
Right.
What kinds of sensations are we talking about here?
So tactile hallucinations are all about feeling sensations on or in your body without any physical cause. One of the most common examples, and probably one of the most well-known, is formication.
Formication.
That's the sensation of bugs crawling on or under your skin.
Oh, yeah.
Very unsettling. But tactile hallucinations can also involve feeling like you're being touched.
Okay.
So, someone grabbing you, tapping you, pushing you, that kind of thing, when no one is actually there.
Yeah.
Your source also mentions temperature sensations, feeling hot or cold, or even pain or pressure without any real external cause.
So basically any kind of physical sensation you can imagine, your brain can generate it,
It seems that way.
even without any actual external input.
Okay, so we've covered the different types, which is already pretty mind-blowing. Now, let's shift gears a little bit and talk about what can actually trigger these hallucinations, what causes them. Your source material breaks it down into some helpful categories here.
And I think understanding the causes is really key for any kind of management or treatment. So the first category we have here is psychiatric causes. And so, right off the bat, schizophrenia is a big one. And it's often associated with both visual and auditory hallucinations.
Bipolar disorder is another condition where hallucinations can occur, particularly during those acute manic or depressive episodes.
Right.
PTSD, post-traumatic stress disorder, is also listed.
Okay.
And, severe stress and trauma can lead to hallucinations, including distressing voices or even flashbacks that can have this really vivid, almost hallucinatory quality.
Okay, so mental health clearly plays a role for a lot of people who experience hallucinations.
Yeah, absolutely.
Now, what about issues with the brain itself? So neurological causes.
Yeah. So neurological conditions can also cause hallucinations. Temporal lobe epilepsy, for example.
Okay.
So seizures originating in the temporal lobes of the brain.
Which is, what does that part of the brain do?
Well, it's really important for processing sensory information,
Okay.
which makes sense why seizures in that area can cause these kinds of false perceptions. So temporal lobe epilepsy can lead to auditory, olfactory, or gustatory hallucinations. Parkinson's disease and Lewy body dementia are often associated with visual hallucinations. Brain tumors that affect sensory processing pathways, those can cause hallucinations too. And then, neurodegenerative diseases like Alzheimer's and Parkinson's, those can sometimes lead to visual, olfactory, or tactile hallucinations. Even migraines that are accompanied by an aura, those can produce these visual disturbances, things like flashing lights or zigzag patterns.
Which could be considered a type of visual hallucination.
Exactly. And, another interesting one is hearing loss and tinnitus.
Okay.
So sometimes that can lead the brain to generate phantom sounds as if it's trying to compensate for the lack of external input.
Wow, so your brain is trying to fill in the gaps.
That's a great way to put it. It's like it's trying to make sense of what's missing.
That's fascinating. Okay, your source material also lists substance-related causes as another big category.
Yeah, and this one's a little less surprising, I think.
Great.
So you've got hallucinogenic drugs like LSD, psilocybin, DMT. Those are well known for causing really intense visual and other sensory hallucinations. Stimulants, things like cocaine and methamphetamine, are known to sometimes trigger tactile hallucinations, like that feeling of bugs crawling on your skin.
Right.
And then maybe a little less intuitive, both alcohol and benzodiazepine withdrawal can actually lead to hallucinations too.
So it's not just taking the substance, it's also the process of coming off of it
Exactly.
that can cause these disruptions in your perception.
Yeah. Your brain is basically going through a kind of recalibration process, and sometimes that can lead to these really bizarre experiences.
Wow. Okay. And then finally, you've got sleep-related hallucinations. I think this is something that maybe a lot of people have experienced at least a mild form of.
I would say so, yeah.
Those kind of weird things that happen in that space between waking and sleeping.
Right, those hypnagogic hallucinations. Those happen as you're falling asleep,
Right.
and they can be really vivid images or sounds.
Yeah.
And then you've got hypnopompic hallucinations, which happen as you're waking up.
Hypnopompic.
Yeah, that one's a little harder to say.
It is.
But sometimes those can cause that really unsettling feeling of an unknown presence in the room.
Oh, yeah.
And then, of course, if you're significantly sleep deprived for a long period of time, that can actually induce hallucinations across multiple senses.
Okay, so your brain is just so exhausted that it starts to misfire.
Yeah, that's a good way to think about it.
Makes sense. Okay, well, that covers the causes, which is a pretty extensive list. Now let's talk about the impact. So how can hallucinations actually affect people's lives?
It really varies. It depends on the type of hallucination, how often they occur, how intense they are, and of course, what's causing them.
Right.
But the source material breaks it down into kind of three main areas: psychological, social, and physical effects.
Okay.
So psychologically, hallucinations can be very distressing.
Okay.
They can cause fear, anxiety, confusion, and because they feel so real, they can also trigger paranoia.
Right.
You start thinking you're being watched or followed, or that someone's trying to harm you.
Yeah, that makes sense.
Emotional instability, mood swings, agitation.
Mm-hmm.
That's another thing that can happen.
Okay.
And, if the hallucinations are persistent and they're really upsetting, they can contribute to depression and social isolation.
Right.
And in some cases, unfortunately, they can even increase the risk of suicidal thoughts or actions.
Yeah.
And then cognitively, it can be hard to think clearly, to focus, process information.
Right. So your brain is kind of occupied with these other things that are happening internally.
Exactly. It's hard to concentrate
Yep.
when you're dealing with those kinds of sensory experiences.
Yeah, absolutely. So it sounds like it can be a really isolating and challenging experience internally. But then there are also, you mentioned, the social effects.
Right. So, if you're experiencing these things, you might be afraid to talk to other people about it. You might be worried about being judged. So you might start to withdraw from your friends and family. You might isolate yourself.
Right.
You might misinterpret what other people are doing or saying.
Right, because you're seeing or hearing things that aren't really there.
Exactly.
So it can really damage your relationships.
Yeah, it can.
And I imagine it could also affect your work or your school life as well.
Yeah, absolutely.
Hmm.
It can be hard to focus, to remember things, to interact with your colleagues or your classmates.
Yeah.
You might have trouble keeping up with your work or your studies, and that can lead to, even job loss or academic problems.
So it really kind of permeates every aspect of your life.
It can affect your whole life.
Yeah. And then in addition to all that, your source material also mentions some physical risks as well.
Yeah, and this is really important to talk about because sometimes these hallucinations can be dangerous.
Okay.
So, if you're seeing things that aren't there, you might misjudge your surroundings and have an accident.
Right, like trip and fall or something.
Exactly. And in some cases, auditory hallucinations can involve something called command hallucinations. So that's where the voices are actually giving you specific instructions. And if those instructions are harmful,
Yeah.
it can lead to self-harm or even suicide.
Yeah. That's really scary.
It is. And then, more generally, sometimes people will react in unexpected ways to their hallucinations, and that can put them or other people in danger.
Yeah, because they're responding to something that's not actually happening.
Right.
Yeah. Okay. So, all of that really underscores how important it is to get help if you're experiencing these things and to find ways to manage them. So, speaking of management, the source material does touch on some treatment options. And it sounds like the key is really to address the underlying cause.
Absolutely. That's really the first step, because hallucinations can be caused by so many different things.
Right.
The treatment really needs to be tailored to that specific cause. So, for example, if it's a psychiatric disorder like schizophrenia or bipolar disorder, treatment often involves antipsychotic medications,
Oh, okay.
mood stabilizers, different forms of psychotherapy, things like cognitive behavioral therapy, CBT.
Right.
If it's a neurological condition like epilepsy or Parkinson's disease, you might need anti-seizure medications, different approaches to dementia care, maybe adjustments to your Parkinson's meds. If it's substance-induced, well, then the focus is going to be on detox and rehab, and then ongoing therapy and support groups to help prevent relapse.
So, a whole range of different approaches depending on what's going on.
Exactly. It really depends on the individual and their situation.
Now, you mentioned antipsychotic medications. The source material does list a few of those specifically.
Yeah. So medications like risperidone, olanzapine, and clozapine,
Okay.
those are commonly used to help manage, especially auditory and visual hallucinations, and they're often prescribed for people with schizophrenia and other psychotic disorders.
Right.
And as we mentioned, CBT, cognitive behavioral therapy, can be really helpful. And that can help people learn to identify their triggers, to challenge their hallucinations, to develop coping strategies for dealing with the distress.
Right. So, you're not just trying to make the hallucinations go away, you're also trying to learn how to live with them.
Exactly. It's about managing them, about reducing their impact on your life.
Yeah.
And then, beyond medication and therapy, your sources also talk about the importance of lifestyle changes.
Okay. Like what kind of things?
Well, getting enough sleep is huge.
Right.
That can really help to prevent sleep-related hallucinations. Avoiding drugs and alcohol, that's really important too.
Yeah, absolutely.
And then just generally finding ways to manage stress and anxiety.
That's okay.
Things like mindfulness, relaxation techniques, that kind of thing.
Right.
Because stress can definitely make hallucinations worse.
Right. So, it sounds like it's a really multifaceted approach.
It is.
There's the medical side, the therapeutic side, and then just taking care of yourself overall.
Right. It's about addressing the whole person, not just the symptoms.
Yeah, absolutely. Well, this has been a really fascinating deep dive. I feel like I've learned a lot about hallucinations. We've covered what they are, the different types, the causes, the effects, and even some of the treatment options. It's really remarkable how complex these experiences can be.
Yeah, it really is. And I think what strikes me is just how much we still don't know. We're learning more all the time, but the brain is such a complex organ, and hallucinations really highlight just how much mystery there still is.
Yeah, absolutely. And it really makes you think about what it means to perceive the world around us. If our brains can generate these really convincing experiences internally, what does that tell us about the nature of reality itself?
That's a great question. And I think it's one that philosophers and scientists have been grappling with for centuries.
Yeah.
What is real? How do we know what's real? And what does it mean when our brains start to create their own reality?
Yeah, that's something to ponder.
It is. It's a really deep question.
Well, on that note, I think we'll wrap up this episode of The Deep Dive. As always, thank you so much for listening, and a huge thank you to you for sharing your expertise with us. It's always fascinating to pick your brain.
My pleasure. It's been a great conversation. And yeah, I think hallucinations really do provide this unique window into the human mind.
Yeah, they really do. And, as unsettling as they can be for the people who experience them, I think there's also something really fascinating and even beautiful about the fact that our brains are capable of creating these whole other worlds within themselves.
I couldn't agree more.
So until next time, keep diving.
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.